company of the lawyers. Thank you. I designed these questionnaires only on the question asked by the insurance company and the lawyers and other institutions, and plus my own personal experience for doing hand surgery almost 45 years now, and a microsurgery. As you can see, when the patient walks into your surgery, he already had few operations or injuries or pain and suffering. And if you take him straight into your room, start asking so many questions, one after the other, and the patient gets confused and he can't answer the question properly. So I thought I must have a system where patient comes in, he sit down in the waiting room, in nice room. Most of the people have lovely waiting rooms and air conditioned, and if it's a hot weather, you have a glass of cold water and sit down and then fill up this form. My secretary tell them, look, these questionnaires are easy to understand and fill in. And if any questions you don't understand or you don't want to answer, please leave them and my doctor will discuss with you. And again, if I find that those questions are not that important for that patient, I don't press that you should answer that question. If I think that question is relevant to answering my question to the insurance company, the lawyers, then I explain to him why I asked this question. So not all these questions are for everybody, but 80–90% you have to ask those questions to write a correct, accurate, and complete report. And it might be in the beginning look like it's very intimidating, but once you get used to it after 2 or 3, it's so easy because every question is very simple question and answering is not difficult at all. Most of them is just tick marks. And when they start from the beginning, we have to identify the person. To do that, we normally look at either their license or their passport, because there are few people from overseas and things like that, they have got no license and things like that. And we put on the top, if you scroll right to the top of the thing where it says strictly confidential, next to it are the photo ID. Either it can be a, as I said, license, and then we put a driving license, then we put the number there. And if it's passport, we put the passport and see what day it expires. And then we see if the patient need an interpreter or not. If he does need an interpreter, we put down yes. And then we write down the name of the interpreter and then his number. They always have those numbers where they you can identify they are genuine interpreters. And then I written everything that I cannot advise you on your condition. This is for medical legal report. And they understand that. And sometimes they still ask the question, what do you think you should do, doctor? I said, look, I can unfortunately can't tell you, and I go write a report to insurance company. I'm sure they will, be able to come in touch with you. And the next good thing is that write their own personal name, surname, and given name, and their address. It's very simple, straightforward, date of birth, and marital status, and all those things. Anything they don't want to give, they can easily leave, no problem at all. And one of the main reasons is that they fill this form themselves, and then they sign it. In this way, they cannot say that I said that and you misunderstood me, or I didn't mean that, because they read it, they sign it, and tick mark it, and I said, then I go read them each point separately, again, one by one. So I know that they filled it. Anything if they're not filled, then I said, I need this information for this purpose reason. And 9 out of 10 said, yes, I understand that, and they give me that information. And if they don't want to give any information, personal information, I'm quite happy with that, no problem at all. And because identification is very important. I remember one case where I did a medical legal report on this lovely lady, and they sent me a video of that lady. And I looked at the video and looked at the lady. I said, look, that's very different. The age is different. The color of the hair is different. The shape of the lady is different. So I rang the insurance company. I said, I don't understand that. This video you sent to the lady, name is, some name is same, but rest of these things I can't match up. And they said, oh, sorry, I'm glad you rang us. We were going to ring you back because we have been, the investigator have been following her daughter instead of, the lady herself. So that's the reason I identify them properly, all those things, so that I know who they are. That's the reason for all the height, weight, and color of the hairs on this, so we can identify them properly. Then after that, we asked them how much they smoke, how much they drink. There's a relevant questions because some of the questions the insurance company and the other ask if any other reason you find anything else you want to say, and then I have to know a little bit more about their drinking and smoking habits as well. And also it helped me deciding what kind of treatment they should have. Then we go to the employment history. And this way, it's very simple, straightforward, what your usual occupation is and what were you doing at the time of this accident happens. And then the basic qualification is important, whether they went to year 10 or year 12 university, because if I used to answer the question that what else can that person do if he cannot do this and help the rehabilitation point of view, yes, he can be rehabilitated in this branch because he has this qualification. So even they can go back to his pre-injury duties, at least because of his qualification he has, either he can have further qualification to update his all this experience and get another job instead of going to his pre-injury hard work he was doing before. So they are very simple, straightforward question. And who was employed at the time of injury, how long were you off work after the injury, were you continue working, and how many hours you work, and how many hours you work now, and how many hours you can do, according to my opinion. But then always have a help of rehabilitation coordinator, because these guys can go and do the work site assessment. And once they do work site assessment, then they can create a plan, back to work plan, after looking at the work site, because I cannot go there, but they can go there. I'll give you one example. Which was 30, 40 years ago, there was a motor mechanic. And the boy asked, can he use a spanner? And I said, well, there should be no reason that we can't use a spanner. But important thing was to realize that how big this spanner is, which position he's using the spanner, because he was working under the car with a heavy spanner which fell on his face. So that's why it's very important to do the work site assessment to see exactly what they do, and so that we can rehabilitation point and we can advise them what kind of work they can go back after they have recovered from the injuries. And then is what job description was before the accident happened and what they have been doing job after. That helped me answer the question most of the you guys asked me. Then we go to the social or current information. Then I wanted whether he can drive or he cannot drive, what kind of car he drives, what his hobbies were. That's very important, because insurance and lawyers ask me what is hobbies, can they do it now or not? Have those hobbies contributed to his injuries, or has had any further injury after his injury at work as a result of hobbies he's been doing? So I had to ask all questions to see what your hobbies were. Can you do it now? How partially or completely you can do? Then also asked what the work at home, how much they can do, whether they needed a assistant or not. They quite often, the insurance company asks me whether they needed assistance in the past, now, or in future, will they need assistant or not? And then I go on to if he has seen me before at another report, because sometimes I have to do a supplementary report on those patients, and if he has other workers' compensation claim for same injury or same hand or same arm, that could help me, because if they had already disability in that particular hand and had another injury to the same hand again, how much is contributed by the previous injury? Was he doing the work he was allowed to do by the rehab because of his previous injury to that hand or arm? Then we go to next section of investigations. I like to see the films myself. The reports are quite accurate, but sometimes I find that the reporter x-rays have left few of the things which are obvious on my x-ray. But by the way, I only do hand cases. I do not do any other medical legal reports or insurance report on no other part of the body except the hands for the last 45 years. And so I like to see my own x-rays and or MRI or ultrasound, so I'm not sure that the report agrees with the films itself. And many times I find that about these 15-20% cases of mine, they miss things which are on the x-rays or CT scans. And then I discussed with them very politely that what do you think of this? And then they say, oh yes, that could be that possible thing. And that helped me in writing a more accurate report. So I like to ask them to bring the film themselves. If they haven't got the films, And I request the lawyer or the insurance company that if you could kindly ask the client to deliver the films on my surgery or send a picture in the email so I can have a look at the films myself. Reports are all right, they're good. They are reported by experts and I have full respect for that, but I'd still like to see the films myself. Next is general information. This is important for some of the diseases the body can affect your hands. I'll give you a very simple one, which is long-standing diabetes. It can cause peripheral neuropathy and can give you symptoms of carpal tunnel syndrome. And then if you had to decide whether it's carpal tunnel syndrome is a result of work or because of his long-standing diabetes causing peripheral neuropathy. I just think one of the examples, but there are other examples are there too. And also, before I ask them what kind of treatment they can have, it will also depend on the general conditions, because a treatment for one patient may not fit the other patient because he gets other problems, and the operation is contraindication in those cases. So that's the reason I asked them these questions regarding their general health information. But only the reason they don't want to do it, I'm quite happy with that. But if I find that this is important for me, then I explain to them why I asked this question. And as I said, 9 out of 10 will say, yes, I understand that, and they tell me. But if they don't answer any question, they don't want to, I don't enforce them until I think that that question is important for me to advise properly. Next is the injury and incident information. And I want to know whether they're right-handed or left-handed, because if you're that dominant hand, you have to have a good reason to advise them that dominant hand is important, and the treatment may differ if the person has non-dominant hand injuries, because the dominant hand is the one to be using all his life, and if that is injured, and if your treatment is not more accurate about that, then it's trouble for the other person to start learning to use his left hand, which he hasn't used for is all the things he does every day. So dominant, whether right or left hand dominant, they have to mark on the box. Then they, obviously any past injury, part which is injured, what date was injured, when did he inform the insurance company, because sometimes the injury happened 6 weeks ago, 2 months ago, then they didn't inform them, and the 2 months later they inform them. So then in this way, I will know whether they had any problem in between those period when they did not inform the insurance company. Then how the accident happened. Mode of injury is very important, because they'll tell me exactly how much part is injured, where it happened, how deep the injuries were. So they fill it up themselves in proper way. And then if I want to explain them, I explain to them again. Then whether wearing gloves or not, any problem with the other hand is important, because the treatment of that hand will depend whether there's a problem with the other hand as well. Then which GP you saw, we sometimes need information, who you saw the first. And then if you know he saw the GP or he went to emergency department, did he go by ambulance or he drove himself or some other people drove, it tell me the intensity of the injury if you have to call ambulance. And then other thing is which hospital he went, the information you want. And did he have which specialist he saw? Very important. How many times he saw a specialist? Because if he has seen specialist 20 times, this thing is pretty serious if he's seen it so many times. Same with the physiotherapists. How many sessions he had physiotherapy had? And when the last time he had his physiotherapy is also important for me, because if I had to advise whether he should continue physiotherapy or not. And sometimes people have 3-4 sessions, they don't see any physiotherapist for 1 year. And if he said, I haven't seen him for 12 months, I said, well, why didn't you see him? Or said some different reasons they give. So I said, well, the first line of treatment will be to go back to hand therapy, because mostly people use the word hand therapy because we use specialist subspecialty of physiotherapy is hand therapy. So all these questions are very important from my point of view to write the report very accurately. And then they tell me who the physiotherapist is. And then important thing is that they've seen the pain management clinic or rehabilitation coordinator and how many operations they had. If they remember the dates of the operation, that is very important for me, whether they had 1, 2, 3 operations within a month or two, or they had every 6 months or 3 months when they had the operation done. Then they write down what the current symptoms are, what they really have. Another thing is, if there's not enough room on this performa, always give an extra piece of paper to them that you can write on that piece of paper, and then they sign that paper and date it as well, and then attach that paper to this performa. But most of the time they don't need an extra. They write down this 9. If they get a current symptom more than 9 symptoms, they think it's pretty serious. So if they need another paper, we always provide them. But most of the time, these 9 symptoms they fit in this page. Then I know when the symptoms start and how many days and weeks, and current what is that using any splint or splint or any other treatment they're having at present. They all take mark very easy. Then I go down to the next page of medication. What medication are they taking? What doses are they taking? And how frequently they're taking? And when was the last, dose they're taken? And if he had some sedation half an hour or an hour before, then I have to know that he's slightly sedated at the moment. So I have to ask him either to come back again or see how much effect of the sedation is. Then we ask if any side effect of the medication, any other injury during that accident, because if he had injured his hand, he might have injured other hand or other part of the body. So it's important for me to know what other part of the body he injured. Any on the contraceptive pill, because sometimes they get some bleeding extra from the contraceptive, and also the pregnancy. We want to know if any advisor treatment or X-ray. I want to get it done. I want to make sure they're not pregnant. In the past history, we want to know any operation in the past, any other injury to the same hand in the past, or any injury also, but I don't after the accident, if they have a second or third injuries at home or work or at hobbies, or any other serious illness, and how his general health is. And then they have a declaration here that information they have given me by them or by the interpreter or by my secretary, because if they come and they have injury to the right hand and the right hand is dominant and they can't fill the form themselves, my secretary will help them filling the form, and then I know who helped them filling the form, and then they sign it and then date it. And if they want somebody else to come with them, they have to put that person's name and give me consent that I advise him that you come in with the person, but obviously they will not answer any questions and they will not interfere with the examination. Then the next page is the my own use. This is the doctor's use. They finish here, right? I write on post-traumatic events myself, and again, if I need an extra page, I put another page which are attached to this, put a date on that name and put it attached to the form. Then I write on all these symptoms they have got, and they're easy to mark, tick mark. Then whether you got any pain, where the pain is it constant pain or intermittent pain? Because when you do examination, sometimes you tend to overlook all the questions you want to know. And then later on you remember, because sometimes in busy practice, we're all humans, we can overlook some of the question which is important, but if it's already written there, then you cannot forget. It's all there. And if you want an extra page to elaborate what you want, you can attach the paper with it, but at least you will not forget any relevant question you want to ask for that particular condition. And then these are the diagram. The picture tells 1,000 words. So you draw on that picture where the problem is, where the injury is, and then where the loss of sensation is, where the deformity is. You mark that with a pen. And in the bone set, with the fracture is, you can mark where the fracture is. In this way, you can immediately see where the problem in the thing is. And then the measurements of the joints is very important with the goniometer. I saw the case the other day, and the reporter, one of the other experts said that his tendons were intact because he had a pair of tendons, the profundus tendon, which moved the last joint. And he said that he was progressing well because he could touch the tip of the fingers about 1 centimeter away from the palm. You cannot touch it, but just 1 centimeter away from the palm, which means he was saying his profundus tendon was progressing well. But I don't think that's the way to judge whether the tendon is intact or not, because you can, if you look at my hand, you can touch the palm without moving the last joint. This doesn't mean that you have profunda tendon intact. If you get a good movement of the MCP and PIP joint, you can touch it. The only way to test whether the tendon is working, to see that joint, and not just see that, you have to record the measurements of that joint. And that's how you're going to progress it. Otherwise, you cannot say that the profunda tendon is intact, because that patient ruptured his tendon. And the notes were saying that the tendon is intact because he could bend his finger about 1 centimeter from the palm. But that's not an accurate way of recording. The only way to see whether the joints are moving and the tendons are intact is to record the range of movements of each joint. And you can see this the squares look a bit intimidating, but once you know what to do, it's very easy. You just get a goniometer, write down flexion extension is very simple. And that is the only accurate way of assessing how the range of movements are, whether the tendons are intact or not. Then I also record the next page, examination of the hand, the wrist. You see how the wrist movements are, and then again you record it. That's the only way. You just don't say move your wrist backward, forward. Oh yes, it's moving. Now you have to record each and every range of movements, and then whether say within range of normal movements or not. Because some people have extra range of movement. Few have got less, depending upon how thick hand they are, how hardworking they are, how overweight they are. So if one hand is injured and his range of movements are less, you compare with the other side, because that may be his normal range of movements. So that's why we always compare one with the other side. And in this way, there's normal range, but if somebody's out of range, you check with is his normal out of range, because the other hand is the same or is different from the other hand. Then I write all the other things, what the gross power is, what the pinch power is. I'll do a couple of tests for the carpal tunnel and decurving disease. And I check the circumference of the forearm and arm. In this way, with any wasting of muscles because of disuse and not using his hand or arm for a long time, or is more swollen, swelling, and that is the circumference is more on that side because of the swelling and edema. And then we do all the motors and test the sensation with small instruments. We test the sensation, 2-point discrimination, and then we see whether any particular tenderness anywhere, any dislocation, any triggers, and then wasting of muscles. Then check the circulation of the thing, whether good circulation or not. Then any color changes and any successive sweating or temperature because of complex regional pain syndrome, and then some skin texture. Everything is recorded here. Then this way you cannot miss any of those things, which is essential. Then I also check the neck and shoulder and elbow, see whether no problem there. I don't elaborate on this because that's not my specialty, but I want to make sure the problem with the hand is local problem and not referred from the neck or shoulder. And if there is a find a restricted movement of the neck, which he hasn't mentioned, then I ask him, how you got a problem on the neck for how long? Oh, I've got a problem for 2-3 years, and I've got a pinched nerve here. So he's tingling a thing that may be coming from his neck as well, rather than just from the hand. So just elaborate, I don't elaborate on them, but just if there is any problem, I mentioned that he should be seen by an orthopedic surgeon specialized in neck or shoulder, or, and even them insurance company to decide. Then we do a different few tests for the wrist to see that the scaphoid ligament or ligaments are injured or not. Then I write down if there, then you have to put whole person impairment, or all the movements here on the next page. And then at the last, I put a checklist, whether I've done all those things. And tick mark, yes or no, yes or no. In this way, I don't miss anything. Maybe if I sort of didn't have this, I might remember 60%, 70% of the things. But when it's there, my chances of missing anything is, we can only reduce the probability. Chances may be less than 5%. But if I didn't have that, probably I might miss 15, 20%. And that's not enough in my books. That must be more accurate reports, and you should know everything about the patient hand condition before you finalize your report. Then we put all these figures. This is from AMA 4, AMA 5, and then add up and give the WPI. Now, In addition to that, if I find that I need for more information, before I write the report, I'll not be asked the insurance company lawyers, could you provide me more information? If you haven't got it, then I'll send you this report. And when you get the information, I'm quite happy to write a supplementary report, because I don't want to delay the reports, because you guys are very busy. And so in this way, at least the report is there. You got a whole preliminary report. And if any of the things are missing in this, I always ask them to provide me before I give my final opinion. And I like you, everybody, to give their feedback on this. So I want to improve every day in this performa. If anything I missed, because 40 years ago, 45 years ago, things were a bit easier. But as the time passed, then AMA 3, 4, 5 come up. We had to be very accurate, and the insurance company lawyers, they like to have a very precise answers. And if you haven't got a accurate information, you cannot answer that properly. In this way, they write you back again, you haven't clarified this. I don't remember for the last 5 or 10 years I had any queries regarding that you overlooked this question, because I looked at the answer here. I said, this answer is based on the information provided to me on this performa, which is signed by the patient or client. But if you can need extra information, I'm quite happy to send you a supplementary report. But if you, any of you think that we should add any extra question in this, I'm quite happy to add into this. But I think I have sort of asked every question I think is important for writing a accurate report, which help you to make a decision for the patient's future and his future treatment and management. Thank you, Michelle, and everybody else, and I'm quite happy to answer any questions.
Thank you so much, Dr. Kapila. What I, as observing this and dealing with many specialists, but also in my dealings with lawyers and insurers, I really like the way you explained not only what you wanted, but why you wanted and the impact of not getting that information. So often we do get asked by case managers and lawyers, why does the doctor want this? And it's really good to hear that understanding and really good to see the forensic approach that you have to gathering information to make a substantive and complex report, which I think is what everybody wants. It's the gold standard. I will open it up. If people would like to ask a question, please unmute yourself, or you can put the question in the chat if you prefer for me to read the question out. Please go ahead. No one is unmuting themselves. When this happens, Dr. Kapila, it's because the presentation's so good that you answered all their questions and there's nothing anyone. It was really well delivered, good pace, good information. Can people indicate with a show of thumbs ups or something that you don't have questions? Yep, beautiful. Whole range of questions. Looks like it's gone down a treat. Dr. Kapila, thank you so much. A wonderful presentation. Thank you, Gregor.
If anybody wants to think of, they're most welcome to send me an email or something. I'm quite happy to answer those questions to them.
Wonderful. Thank you, sir. And thank you, everybody. Go and have a great rest of the day.
Thank you kindly. Thank you, Michelle.
Bye.
And thank your staff for their help.
Will do. Ta.
Bye-bye.